keep in mind too, there are some other things that are not, that are considered a thin liquid. Patients that are on any liquid consistency restrictions, such as nectar or honey thickened liquids, cannot have Jello, cannot have, if it's a soup, you're going to make sure that you need to thicken that soup. Just because there's chunks in the soup doesn't mean that that broth is not a thin liquid. It is, so it's definitely going to need to be thickened. As Caroline mentioned, ice is also a thin liquid. Ice cream is also a thin liquid. So those are popsicles, things to keep in mind the patient is not allowed to have if they are not on a thin liquid consistency. So here we have our nectar. It's all thickened up. This is just water. And the patient would be allowed to drink this. You definitely want to make sure that you're thickening to the right consistency. So always make sure you read the instructions on the back of the thickener packet and make sure that you're thickening up to the right consistency.
Why don't we go over some strategies that we might use when working with a patient, some swallowing strategies. On this green sheet, you'll see different recommendations that we might give. These might include taking a small bite or a sip of a drink, and this would be a teaspoon or less. We can show you what that looks like.
It's really important to follow the instructions on this sheet. It's easy to look past and set the patient up and let them go ahead and eat, but there's a reason for this sheet to be up there. If you see this sheet, it means they have specific instructions and things to keep them safe while they're eating. One thing to keep in mind while Caroline's getting ready is there's also the monitoring section. On this specific sheet, it talks about one-to-one supervision. That means that someone needs to be with the patient when they're eating. That doesn't mean the patient can be set up and someone leaves. It's really important to have someone there with them to observe, along with pills with close supervision, making sure the patient takes their pills with someone there, not giving the pills and then step aside, but be with them consistently while they take those pills.
Something important to remember when working with the patient is to always clean your hands. Wash your hands before touching any food, and use gloves as well. The first item on our list is to take small bites and sips. Patients that we see in this hospital at the Center for Rehab Medicine are often what we call impulsive, which means that they like to do things fast and quickly. They also like to take huge bites when they eat. So a bite might look like this, or even bigger if it has different kinds of food. They will try to load up their spoons. So you may have to cue them to take a small bite or a small sip. This is about a half of a spoon. Could even be less if it's noted on the sheet, but this is about as big as we like the patients to take a bite of their food. The second strategy listed on the sheet is to take multiple swallows on each bite. What this means is after they take a bite of food, they need to swallow 2 or 3 times to clear everything out of their pharyngeal cavity. It doesn't mean to take one bite and then take another bite. It means take 2 or 3 swallows on one bite of food. One thing you can look for when they're swallowing to make sure that they swallowed is to look for their Adam's apple to go up and down. That's how you know that they've swallowed. You can also feel their throat to feel their Adam's apple moving up and down after they've swallowed or during their swallow. The third thing on our sheet is to alternate liquids and solids. What this means is the patient is to take a bite of food, chew it up, swallow it, and then to take a sip of their drink. And then take a bite of their food, and then take a sip of their drink. The fourth thing on our list is the swallow, cough, swallow sequence. This might be also used with a throat clear and having them clear their throat if they have a very wet vocal quality. And what you can have them do is maybe they may be drinking their sweet tea for lunch. You have them take a sip, swallow, clear their throat, and then swallow again to clear everything down. So that's take a sip of their drink, swallow, and then swallow again. The next thing on our list is to have the patients chew on their strong side. Very often we have patients who have hemiparesis on one of the sides of their body, either left hemiparesis or right hemiparesis. So that's not only in their arm or their leg where they have the paresis. Very oftentimes it's also found in their oral cavity. Their tongue may be weak, or their cheek may be weak, or just the facial muscles in general may be weak on that side of the body. What we'll cue them to do is to place their food on the strong side. So say they have left side weakness, we'll have them put the food in on their right side of their mouth to chew up the food and create the bolus, or the ball of food, to swallow down. Sometimes patients will pocket their food, or just hold it in their mouth, kind of like a chipmunk, and it can get very big, and you can see visibly on the outside of their cheek that they're pocketing this food. What you'll have to do is cue them to either use their tongue to sweep out the food, or they may have to take their finger and put it in their mouth and clear the food out from the top and the bottom to make sure that they don't have any food caught on that weak side. You may have to do this every few bites or so, and always after meals. Check and see that all the food is cleared out of their mouths. The next strategy is used for patients that have pharyngeal dysphagia, which means dysphagia of their throat area. And what we use is called the chin tuck or the chin down maneuver. What this does is that it helps the patient to close off their airway even more and open up the esophagus for the food to go down. What this looks like is you have the patient take a sip of their liquid. When the liquid is in their mouth, before they swallow, they have to put their chin down to their chest. I like to tell my patients to look at their toes or look at their belly button. Your chin needs to get as close to the chest as it possibly can, and then you swallow. This is what the chin tuck looks like. So you take a sip, you put your chin down, and then you swallow. Other strategies you might see that we will use on this is to turn the patient's head to one side or another, and this also is a strategy we use to increase the airway protection for the patient. It's the same idea as the chin tuck, except for you're turning your head to one side or the other. So it might tell you to have the patient turn their head to the right and swallow, or to turn your head to the left and swallow.
Remember that at